Hello, my name is Juan Antonio Perez, and I'm delighted to be with the co-creator and creative genius of NLP, Dr. Richard Bandler. Dr. Bandler, a pleasure as always.
It's always a pleasure to talk to you, Juan.
I have a very, very important question from the people that are psychiatrists, coaches, and psychologists. And over the years of your 52 years experience, how much does your work has impacted their practice?
Well, it depends upon the psychiatrist, of course, but the people that use these techniques find that they get more personal satisfaction because they get more results. Because everything I do is result driven. We don't really have a theory, we just have technologies that help people that neurologically function better. And most of the things I discovered were as a result of working with psychiatrists who supplied me clients and opportunities to try new things. And those people, incorporated in their practice things. Some of them were even afraid they were going to wipe their practices out. But the truth is, you're never going to run out of crazy people on this planet. And it's not about just solving one problem. It's about getting people to be problem solvers. And so that when challenges in their life come up, rather than falling apart or backing away, they have the personal resources to deal with it. And this is what coaching is all about, if you ask me. Positive psychology is a little of NLP salted in with a little psychology. And, I've seen this permeate throughout all kinds of things, whether they use the word or not. And that's not the important part. People are now talking about results. Young psychiatrists are studying things about neurology in a way they never did. Other than maybe an X-ray of your head, and prescriptions, they weren't really thinking about neurotransmitters and oxytocin and all of these things. And so psychiatrists, younger ones, have now become more sophisticated. They're doing screens and checking all the minerals to make sure that you're not low in potassium or you don't have iron poisoning. In those days, they would bring me clients. I'd look at their fingernails and I'd know. I go, this guy's got some kind of mineral building up in his body. We got to chelate it out. And a lot of psychiatrists had forgotten about being medical doctors. And I'm here to remind them that's a great thing that you know about medicine. That's not a bad thing. That's a good thing. Use your medical skills and your ability to test, your ability to do things to check and double check. Even on TV shows now, the psychiatrists are running brain scans and MRIs and looking at things to find out what's going on and changing people's behavior and lifestyles so that, they eat better and they take the right minerals so that they stand a better chance of being smarter. People are starting to decrease the amount of medication, but not everybody. Some people, over-medicating people for maintenance is just lazy. And what I tried to put in the field of psychiatry and psychology, because I worked with a lot of psychiatric patients over the years, was to instill in them that the end user is the person that's supposed to win in this. And that if they look at the end user who's got this and the parents bring in and they go, my daughter's depressed, your job is to figure out how to teach her how to be happy. Not to make her happy, but to teach her how it's done. And that means you have to talk to happy people and find out how they do it and teach her to do the same thing as them. I remember a long time ago, a psychiatrist bringing in somebody that couldn't tell their fantasies from reality and asking the psychiatrist, how do you do it? And he went, what do you mean? I said, well, you drove here in the car. Imagine if you, instead of driving 1,000 miles, had gotten in a plane and flew here. Can you imagine that? And he said, yes. I said, how do you know which one's real? And he said, well, one has a black border around it. And so I hypnotized the woman and I put a black border around all her fantasies and made them feel like they weren't real. And then when I brought her out of trance, because she kept having these fantasies of having killed a relative who was actually in the next room. But the minute they couldn't see them, then she kept screaming that she killed them. And giving her the same machine that the doctor had. See, the answer wasn't in the person. So all of the going through her childhood and all that stuff didn't help because she didn't have the machine that sorts fantasies out from reality. And sometimes people need education. So sometimes it's neurological and sometimes it's just a mineral. I had patients that were hallucinating, just because they had a little piece of shrapnel left over from the Korean War in their head. They'd been hospitalized 7 times, for auditory hallucinations, but it was caused by a piece of shrapnel, not by their childhood. So saying, tell me about your mother isn't going to help.
Yeah.
So in that sense, I've influenced psychology to look more towards where you're going rather than where you've been. There's still a lot of that old shit going on. I haven't got rid of all of it. If I could, I would. But right now, I'll settle for things getting better. As long as they're getting better, we're all headed in the right direction.
Well, thank you very much for your answer. And let's learn new skills.